patients are walking around, skipping breakfast, taking their insulin, walking around with, very high blood pressure, and they're not going in to see their provider for whatever reason. And I think we've made a really good change for these patients in our location. That's the most meaningful, when I kind of see I'm able to connect with the patient and get through what some of their barriers are to help them be successful.
We have a special program called the Diabetes Advantage Program, which supplies free medications, free needles, or free meters and discounted test strips. So we also provide on the other side a lot of education, nutritional support, other things that make it a really robust diabetes program.
Our dietitians conducted MNT, medical nutritional therapy, with the patients, so they got to talk in more detail about carbohydrates and their diet, very specific plans for each of the patients. They also took them on shopping tours, which is unique to Price Chopper, because it's one thing to tell them you should eat this type of bread, but to walk down the aisle and say, oh, you eat this one, here's this one, and this is why it's better, made a big difference. One of the major successes, I think, is proving to everybody the value of a pharmacist in our community. People see the pharmacist talking to the patients and actually making a difference, and the practitioners use them as a resource. It wasn't really shown until through this project.
Number one, we saw a tremendous decrease in overall the A1C. Okay, we have gotten feedback almost to a person on the education, which they didn't have before going into this program. The other thing is that most of these people also had high blood pressure that was uncontrolled. And in working with their physicians, adjusting their medication, almost all these people dropped out of the hypertensive category to either pre-hypertensive or non-hypertensive under the proper treatment.
The patients will come in and they'll meet with me, and they're not necessarily going to meet with their provider. And I've had it happen at least twice where the patient had very high blood pressure at the time, and one patient was even having some tingling down his left arm, and I was able to get him in to see someone immediately. Again, another benefit of being right there. The value of being able to potentially catch something serious for a patient and get them seen immediately when they need to be seen is just huge, more than you could put a dollar amount on.
We're medication experts. We know medication better than anyone else on the team, and with diabetes, that's a huge part. It's with this disease. So I think we bring that strong help with medication. Insulin can be life-changing, can be very difficult to test your blood sugar. These are things that are not just take a pill every day. Diabetes is a lifestyle management, lifestyle change disease. So I think we really helped patients overcome those barriers and treat themselves better, and kind of give them the, empower them to treat themselves better.